I've used a lot of meal services, but Hungry Root truly stands out because it's built around the way real families live and eat. They don't just send meal kits. They personalize your grocery cart and meal plan based on your preferences and dietary goals. All I had to do was take a short quiz, and right away, their smart cart technology started building a cart that fit how we eat. Now, each week feels easier, like someone else is doing the thinking for me. I've been focused on cleaner eating lately, and I love that Hungry Root keeps out over 200 additives, including things like high fructose corn syrup and artificial sweeteners. Their meats are hormone and antibiotic free, and the produce options include organic and non-GMO picks. They also stock brands I already trust, like Oatly, Vital Farms, and Harmless Harvest. One of our favorite meals has been the teriyaki salmon with green beans, light, flavorful, and done in 12 minutes flat. Plus, I've noticed we waste less food, spend less time shopping, and even save money by skipping those impulse grocery buys. Take advantage of this exclusive offer. For a limited time, get 40% off your first box, plus get a free item in every box for life. Go to hungryroot.com/Dr. Meg and use code Dr. Meg. That's hungryroot.com/Dr. Meg. Code Dr. Meg to get 40% off your first box and a free item of your choice for life. hungryroot.com/Dr. Meg. Code Dr. Meg.
The American Academy of Pediatrics, after this catastrophic mistake, a mistake that many argue caused the modern-day peanut epidemic, they never apologized. They just kind of faded. And that's, I think, where people get really appropriately angry, because we don't see the humility that doctors are known to exhibit from our organized medicine leadership. And that is an opportunity, because we can rebuild trust that way. That's why people are still angry about COVID.
Welcome to Parenting Great Kids. Here's your host, Dr. Meg Meeker.
So grateful to have you back on the show, Marty.
Meg, I love your show, and thanks so much for having me. It's great to see you again.
And you as well. You know, I loved your book earlier, The Price We Pay, and I know that did extremely well. This one is even better. I love this book. I couldn't put it down, but this was really good. Blind Spots. And it's going to really get a lot of people fired up. It's going to insult a number of people in the medical industry, which is terrific. We need that. And it's going to challenge us as well. For our listeners who don't know, Dr. Makary is a surgeon, a public health expert, and an author. He champions disruptive innovation in medicine, prompting physician-led solutions like the surgical checklist. A National Academy of Medicine member, he's a thought leader in healthcare, advocating for evidence-based practices and patient-centered health. He is also a professor at the Johns Hopkins School of Medicine, and his qualifications go on and on. So, Marty, let's talk about blind spots when modern medicine gets it wrong. You talk about the fact that medical research is often influenced by politics, and that even when we have clear medical truth that's uncovered by good science, it's hidden. And how often established ideas like it's good to eat a low-fat diet and cholesterol is bad for you are so cemented in our minds as physicians and the lay people that they're hard to change. Your book takes a hard look at medical researchers, physicians, and politicians and their efforts to keep false beliefs alive. Is it fair to say that this book aims to debunk common myths in health and medicine?
Well, you're right in that medical dogma can take on a life of its own. And when we as a medical profession use good scientific research or clinical wisdom to make a recommendation, we shine as a profession. We help a lot of people. But when we rule by opinion and present that opinion as scientific evidence when there's really no science behind it, we have a lousy track record. In fact, we may have created or hastened many health crises in America today. I mean, the obesity epidemic some have suggested is in lockstep parallel with the demonization of saturated fat, which moved the market to ultra-processed and refined carbohydrates, the peanut allergy epidemic you described, and so many others. So at some point, we have to take a step back and actually ask, can our hubris in the medical establishment, the arrogance, actually be harmful and create misinformation that's worsening chronic diseases? We're not moving in a good direction. Every 5-year-old kid in America is going to be on 3 medications pretty soon. The way that we have a medicalization of ordinary life, there's a pill for everything, and pharma is driving the narrative. Instead of talking about Ozempic for kids, how about we talk about school lunch programs? How about we talk about the microbiome and food as medicine? Maybe we need to treat more diabetes with cooking classes than just throwing insulin at people. Maybe we need to treat high blood pressure by talking about sleep quality and stress, not just throwing meds at people. We have the most medicated generation in the history of the world, and it's not working. And so we have to look at medical dogma. And it turns out that the backstories of a lot of our modern health recommendations based on dogma are hilarious and shocking. And so I tell those stories so that people can learn about the truth about their health in a way that's memorable. When you learn about the fighting that would happen at the medical elite level and how one view prevailed, and then how studies later proved it wrong and how they suppressed those studies, you actually learn the truth about what you need to do for your own health and what to eat and the importance of the microbiome and things like that. That's why I wrote this book. People ask me as an author, when do you decide to write a book? Now, you've written books yourself, so you relate to this. I think the reason you write a book is if you passionately believe that there's an important story out there that needs to be told that is not currently being told, that has dramatic implications for the health of the public or society. That's why you write a book, and that's why I wrote Blind Spots.
What I love is that you do on a much larger scale something that I try to do, which is, you're going to go against the grain of the popular belief. But if you know you're right and you believe you're right and it makes common sense, you have to go forward and say it. You have to state it. It seems to me that medical research has gotten worse. It seems that good research papers are few and far between. Let's dive into some of the topics that you bring up in your book that are going to really shock parents. The Salem peanut trial and true believers. Now, when we took peanuts out of kids' diet, I remember thinking, this is kind of odd. I've never seen this before. Maybe there's something that's been happening for 20 years that I've missed. Talk to us about what happened with the peanut trial.
So we have the highest rate of peanut allergies in the world. And there are no peanut allergies in most of Africa and parts of the world that never adopted a recommendation by the American Academy of Pediatrics about 24 years ago. When they were faced with the issue that there were peanut allergies in the United States, and they seemed to be creeping up, although it was a very slow creep and some of it was blown up by the media, they decided to act. The American Academy of Pediatrics, in their sort of, hubris, said, we need to issue a recommendation to tell parents what to do about the rising rate of peanut allergies. And what they told people to do was to avoid all peanut products ages 0 through 3, including moms that were lactating or pregnant. The reality was they didn't know. Okay, and sometimes that's the right answer in medicine. We saw it during COVID. Many times the right answer is, we don't know. Okay, it takes some humility to say that. They didn't know, so they made something up. It just sounded logical to them. Well, guess what happened after they told everyone to avoid peanuts? Peanut allergy rates skyrocketed. We started seeing a new type of peanut allergy, which is a common ultra-severe reaction. Why did we create this? How did this new hypersensitivity get created? Because the American Academy of Pediatrics forgot about a basic concept called immune tolerance. It had been known on the street as the dirt theory in some circles. But if you're around something in infancy, you're more likely to be immune to it. Your body tolerates it. And if you have total avoidance, you can become very sensitive. Your immune system can develop an allergy or severe allergy to it. So allergy rates went up. Peanut allergy rates got bad into this recommendation. And some doctors like yourself said, hey, wait a minute, this isn't working and it's getting worse. And I interviewed one of those doctors who basically was defiant against this central recommendation from the American Academy of Pediatrics. He said, no, I know immunology, this doesn't make sense. And he continued to encourage parents to introduce a little bit of peanut butter and milk and eggs early, 3, 4, 7 months into life, not as a substitute for breast milk, but as a little supplement just to expose kids. And none of his kids got a peanut allergy. And his partners looked on and said, we have all these peanut allergies in our pediatrics practice, but you don't have any. And he said, I don't believe in this. It violates the basic principles of immune tolerance. A lot of public health officials said the reason the peanut allergies are going up is we have to get more kids to comply. Parents are not listening to us. Total abstinence. Make sure there's no peanuts to prevent peanut allergies. They were trying to dig in deeper, and they had it wrong. Years later, in the New England Journal of Medicine, the proper randomized control trial that showed if a kid avoids peanut products early in life, they are 8 times roughly more likely to develop an allergy. And just this year, another follow-up study confirmed those findings. And finally, people realized they had it backwards just a matter of years ago. Now, a lot of people still don't know that you want to introduce these allergens early in infancy. A lot of the WIC program tragically still does not cover peanut butter for infants in America. And the American Academy of Pediatrics, after this catastrophic mistake, a mistake that many argue caused the modern-day peanut epidemic, they never apologized. They just kind of faded. And that's, I think, where people get really appropriately angry, because we don't see the humility that doctors are known to exhibit from our organized medicine leadership. And that is an opportunity, because we can rebuild trust that way. That's why people are still angry about COVID. They feel like they've been lied to, and there's no humility. There's no apology. We need to restore humility in medicine and society.
And I think that one of the points you make, which I feel, is that we are under so much political and financial interests of insurance companies and politicians. And I believe that American Academy of Pediatrics is a political organization. The AMA is a political organization. And they will write to us. I don't know if you got this email, but I got this email and my partners, 9 partners in our medical practice, that if we spread any misinformation about COVID, we could lose our license. Never before in my life has any medical organization threatened to take away my license, which basically said, you can't really discuss this with your patients. And I have a lot of patients in our practice who are very nervous about all immunizations, as a lot of people are right now. And so we talk it through with them. If you talk it through with them and you don't insist that they have vaccination A, B, and C, and COVID, then we are looked upon as bad doctors, and the AAP will come after you. And I think that a lot of physicians, they just go along with stuff. Okay, this is the party line. The AAP comes out with a party line. This is what we're going to insist. This is what we're going to teach. They get that out to the public. I mean, we see that with the transgender influence and treatment of children, little children, because the AAP says this is what you have to do. This is what you're going to do. And if we go against that, honestly can be a little bit scary, particularly if you're in the public eye. So it's a very complicated mess. Let's talk about antibiotics. Now, you and I have known for a long time, gee whiz, maybe we're overdoing it here. This isn't really helpful. But talk about the overuse of antibiotics, because I know the parents listening here are pretty well aware that antibiotics are overused, but they don't know when they should be used or how they should be used. I have just a number of patients come in and say, no matter what, I don't want antibiotics in my patients. So talk about antibiotics and the microbiome and how we come to a balanced approach when it comes to using antibiotics.
Well, the microbiome is one of the biggest topics in medicine that we don't talk about, that is a central organ integrated into all forms of health. The microbiome, by way of background, is, for your listeners, the millions of different bacteria that live in the gut, line the GI tract, and they help absorb food, they train the immune system, they make vitamins, they deconjugate estrogen to an active form, they do all kinds of stuff, including producing serotonin, which is involved in mood. There's a lot of things that affect the microbiome. The biggest thing is antibiotics are like carpet bombing the microbiome. And then certain types of bacteria overgrow. They could be pro-inflammatory bacteria that make the body more inflamed, maybe associated with inflammatory bowel disease or even cancers. There's a rising rate of cancers in young people. It's believed to be connected to the microbiome. Now, antibiotics save lives. We've all seen it, and we don't want a kid to go with hearing impairment because the kid was not treated appropriately with antibiotics for a bacterial ear infection. But antibiotics are massively overused. 60% of outpatient antibiotics are unnecessary, according to one study. And the most shocking study that I discovered in doing the research for this book, Blind Spots, was a study that just came out of the Mayo Clinic that looked at kids who had taken a course of antibiotic in childhood versus those who did not. And they matched the groups. This was like 16,000 kids. These are kids that lived in Olmsted County, which is the county in Minnesota where the Mayo Clinic is. And they found that kids who had a course of antibiotic had higher rates of obesity, were more likely to be overweight, had higher rates of asthma, dermatitis. They had higher rates of learning disabilities, including ADHD. And this was shocking because these were statistically significant findings. Now, we can't, from that epidemiologic study, conclude that antibiotics caused those things, but what they found was something we call in statistics a dose-dependent relationship. That is, the more courses of antibiotics a child took in their childhood, the greater the risk of each of those chronic conditions. Celiac was like almost 300% higher in kids who had taken an antibiotic versus kids who did not. Now, the average 10-year-old has taken 11 courses of antibiotics in America. For what? For viral sniffles? Again, sometimes they're necessary and important. Sometimes they save lives. But most of the courses of antibiotics are based on this dogma that they're not going to hurt you. They don't have any downsides. That's dogma. We're now learning they may have significant consequences for our health. And the other thing that may be affecting the microbiome is C-section deliveries instead of a vaginal delivery. Again, C-sections save lives, and sometimes they're important. We know that as physicians, we've seen it. But most are unnecessary, according to people in the field. And what happens is, in utero, a child has a sterile gut. The GI tract has no bacteria in it. When a baby is born vaginally, it's the bacteria in the birth canal that then seed the GI tract of the baby. And those bacteria are augmented and supplemented by bacteria in the colostrum, in the breast milk, from the skin of the humans and the moms, the mom that a baby will encounter, kisses from grandparents, and all of that transfers bacteria to form the healthy microbiome garden in an infant. But when you're born by C-section, the baby is extracted out of a sterile operating field. And instead of the bacteria from the birth canal seeding the microbiome, it could be the bacteria that normally live in the hospital, what we call the nosocomial bacteria. And the microbiome is different in babies born by C-section. That's why at Mount Sinai and some other hospitals now, they're actually doing clinical trials, taking a vaginal fluid swab from the mother and wiping it on the skin of the baby at birth. It's actually a clinical trial that's ongoing. But one thing that we're starting to see in the medical literature is that there are more chronic diseases in babies born by C-section, higher rates of asthma. And a recent study in one of the JAMA journals, which is a highly respected journal, is higher rates of colon cancer in individuals that were born by C-section. Now, colon cancers, this.
And you think that's related to a microbiome issue?
I do, because another study found that the colon cancers are associated with the finding of a certain bacteria in the colon that doesn't normally live there. It normally lives in the mouth. So some rearrangement of that garden, there's some alteration of that microbiome equilibrium that's likely happening.
I don't remember you putting this in book, but it makes me think of something. It's very routine now to give antibiotics to mothers 24 hours before or during labor for group B strep. Have you read anything about that and what kind of an effect that has on the mother or the baby?
I heard about that debate, and you're right. Group B strep hurts babies. But here's the two philosophies that I've witnessed. One is the routine use of antibiotics in everybody, and the other is the selective and judicious use of antibiotics for a good reason. And if you look at the history of medicine, babies were routinely given antibiotics for no reason except that they were premature, for no good reason.
I saw that. Yeah, exactly. It brings up a good point. When something gets put into place, and you talk about this classic in residency, my generation worked 120 hours a week, and it didn't matter if it killed patients or whatever. But because we did that, now the next generation of physicians has to do it. And we get these bizarre ideas and beliefs that are really hard to turn around. And it just kind of multiplies over time. We have a group think, and it just gets bigger and bigger. And people just don't want to give it up. Physicians, they dig in their heels harder. You talk about this happening with cults, this cult mentality. If things don't go the way you want, then you just dig in your heels more strongly. I have to take a quick break, but before I go, I want to invite you to visit drmegmeeker.com, where you can find a plethora of resources for your parenting journey. Explore our courses, join our free coaching webinar, and take our parent personality quiz. We'll be right back. I've had so many parents say, Dr. Meg, my child is bright, but they're struggling in school and I don't know what to do. If that sounds familiar, you're not alone. And that's why I'm excited to share K-12-powered schools with you. K-12 offers tuition-free, accredited online public education for grades K through 12. These programs let kids learn at their own pace with built-in flexibility that supports different learning styles and family needs. And unlike homeschooling, K-12 provides certified teachers who guide your child's education online. The lessons are engaging, the technology is hands-on, and your child gets real opportunities to connect with clubs, extracurriculars, and even in-person events. As a mom, a grandmother, and a pediatrician, I know how powerful it is when education meets your child's needs instead of the other way around. So if you're looking for something different, something better, go to k12.com/drmeg and find a tuition-free K-12 powered school near you. That's k12.com/DRMEG, all caps. Some days Parenting feels like chasing moments that never quite land. You ask a question, they shrug. You try again, they look at their screen. And you wonder, why is this so hard? That's why I love FamGabs. It's a 70-card deck created by a child therapist who spent 16 years working directly with families, helping parents and kids break through the awkward one-word answers and really connect. The questions are open-ended, thoughtfully chosen, and designed to get your child talking and keep the conversation going. There are even bonus cards just for parents to help you build your confidence in your connection toolbox. If you've ever wished for a better way to understand your child or just to have more meaningful conversations as a family, FamGabs is such a gift. Search FamGabs on Amazon and use promo code DrMegPod during checkout to get 10% off your order. That's FamGabs on Amazon. Use promo code DrMegPod and get 10% off your order. What effect do you think that the media and cultural acceptance of certain issues has an effect on medicine? I'm thinking in particular when you have like the transgender thing, which is a battle for me because I feel strongly that children should be left alone. But we've got the AAP coming out and others saying, no, no, no. This is the course of action that all physicians must take, period, end of story. And then the public jumps on the bandwagon. So you've got this group think that gets a treatment for a medical issue so entrenched in people's minds, it's hard to back off. Talk about that for a little. Where does it come from, and why do we all fall in line so easily?
Well, right now we have centralized decision-making in medicine. We've got these boards and associations that have decided they are going to rule whether or not something is true or not based on their gut feeling, based on an illusion of consensus by people that oftentimes have a political agenda or a party allegiance. We've got to be objective in medicine. When we go with the gut feeling of a centralized medical authority, we don't have a good track record. The opioid epidemic was created by the arrogance of medical leaders decreeing that opioids were not addictive. That dogma lived for 30 years. The low-fat diet dogma lived for 70 years, moving the country to a high refined carbohydrate and simple sugar diet. That probably hastened the obesity epidemic. When we rule by opinion, we have a lousy track record. When we rule with good science, we do good. And my concern with the transgender discussion now is certain questions are forbidden. You're not allowed to disagree. There's a quick dismissal of people who do research to suggest there's a social contagion phenomena. It doesn't follow the epidemiologic incidence patterns of a genetic mutation. It follows the pattern of who's in what social circle on Instagram and why is it 9-to-1 girls to boys? Well, women may be particularly susceptible to images. That's why we see the same ratio with anorexia, 9-to-1 girls to boys. And we're not allowed to talk about certain topics. And I think we have to stand up. We have too many doctors who are afraid. I know you're not afraid, Megan. That's why I love you. A lot of doctors have reached out to me saying, thank you for saying something. I can't say anything. My boss gives me a hard time. I get bullied. And now we have the American Board of Medical Specialties requiring every doctor to now pay them $200 to $300 a year for life and take a quiz to ensure that you can keep your board certification, not your government license. This is a private company saying you're not going to be board certified unless you pay us every year and fall in line with these questions we ask you. Now, we're all for continuing medical education. We already have to do it. It's already required without this new requirement from the private organization. But now you have a central authority that is putting out statements threatening doctors if they put out misinformation defined by them. Well, guess what? 40% of pediatricians in America in rural areas did not recommend the COVID vaccine for young, healthy kids. They are not evil people. They have a different opinion than that majority of 60%. And so we have this new modern-day McCarthyism that's not healthy. And the media will run with it like a bandwagon. They will put the same party loyalists as if, these doctors swear allegiance to the Chinese Communist Party or something before they're allowed to speak. This is not how science is conducted. There's a lot of smart doctors who have trouble speaking up. They may not have a platform like you or I have. And we've got to restore this civil discourse. And I think the hormone replacement therapy bandwagon dogma that it causes breast cancer, which is not true, was propagated by a NIH doctor 25 years ago and a media that ran with the story without asking a simple question: is it actually supported by data? They never asked that question. And as a result, today, people still believe this dogma that's not correct.
Exactly. And that's where I think that over time we've seen, medical decisions that are so influenced by politics, they're so influenced by money and big pharma and even big companies that everything gets very, very muddied. The media will pick up on a story like that because it makes a great story. It's sensational. And I've been told this doing media, behind the scenes. I'm sure you have too. You can't say certain things on air because advertisers won't advertise. They want a sensational story, even if it isn't true. I want to just flip to the other side now and have you talk about some of the problems that I see. And that is, there's a lot of misinformation on the other side. I have a lot of patients coming in who've researched an issue, and then they come in and because they've Googled it and they've read blogs and so forth, they get a lot of misinformation, and then they come in and they want me to do their tests and so on and so forth. So that's concerning to me as well. You don't just have the misinformation coming from literature, science, articles in JAMA, but you have a lot of misinformation coming in the public forum. I just wanted to know your thoughts on that and what you would say to our listening audience about getting to the truth of what's going on when it comes to a medical issue.
Look, when we as a medical profession lose public trust, it's the Wild West. I mean, anything goes. People will latch on to whatever they see on Instagram or read on the internet, and that can be dangerous. Now, we want to educate people, but there's a balance. And when they get fixated on something that is not based on science, it's not good clinical judgment, we've got some work to do to sort of educate people on what's true and what's known and unknown. And part of that is often letting people know what we don't know, right? So if somebody, I do a lot of cancer surgery. If somebody comes in and says, well, I heard that this diet is going to, create toxins that kill the cancer, I can't say you're crazy for believing that, even though I might think that. What I need to do is be objective and say, I haven't heard of any credible research that supports that. My concern is that you could waste a lot of money on that stuff and get false hope. And the reality is that for 1 million people that have come in with this particular situation, there's been nothing that's impressed me as being better than what we're currently offering you. That is an honest and fair conversation to say, I don't know, but here's my opinion, as opposed to this war of censorship that we have now of how dare you, and you can't listen to this, and we have to remove this person. And, there's a strong medical paternalism that has permeated the culture of medicine. It was there when home pregnancy tests were being debated, and the medical establishment said, no, women cannot handle this information on their own without us. Okay. And they blocked it. HIV testing, same thing. People cannot handle this information without us. We have to tell them. And even during COVID, you saw that strong medical paternalism. People can't handle the understanding natural immunity on their own, or they can't do home COVID testing on their own. And the same things surfaced up. There is a strong culture in medicine that we need to recognize. The father of modern medicine, Claude Bernard, said, we all have our biases. We all come from a certain perspective. In medicine, you have to suspend those biases actively and consider new information so you can be objective in figuring out what's best for your patients.
Boy, that's hard. Because, we're told certain things and we take pride in knowing those things. We take pride in treating illnesses the way we were taught. And when somebody comes along and says, well, maybe you're getting it wrong, we don't do well with that. We also don't do well with saying, I'm not really sure what's happening here. And as the older you get in medicine, the more comfortable you become saying, I'm not exactly sure what's happening, but I'm going to find out an answer. I'm going to find out a solution. And I think that many physicians get into a situation where they feel like they have to offer a fix. You talk in the book about the whole HIV being transmitted through blood. And I remember at that time, something was not sitting well with me because we knew that AIDS was becoming an epidemic and we knew that there was HIV in the blood. And yet, you say, the public were kept from knowing that and learning about that. What was going on there?
Yes. How dare you challenge the public's faith in the blood bank system, right? That was the mantra, is that it was more important to guard the fort and to protect the brand than it was to be honest with the public. It was very obvious in 1981. People were coming in with this constellation of symptoms that quickly became known as AIDS, who were IV drug users and who were homosexual males using certain bathhouses in California. Well, those risk factors alone would suggest it's bloodborne. If people are IV drug users are a high-risk group for getting it, yes, it's probably bloodborne. And yet for years, the medical establishment said, no, these are fears. We don't want to discriminate. They were trying to be politically correct. They shut down efforts to ask screening questions for blood donors. And I interviewed a doctor who was basically like, you have to be an idiot not to see what's happening here. People from the HIV clinic are walking down the street, and the same people he saw in the HIV clinic with HIV are donating blood at the blood center because they used to pay people. And the arrogance of the medical establishment for years. And as a result, we killed nearly a generation of people with severe hemophilia. You didn't even see them in the hospital. There was nobody with severe hemophilia for a while because they had all died from the arrogance of this sort of organized medicine. So organized medicine needs to learn how to listen to minority opinions, dissenting opinions among experts. Okay. And we didn't do a great job of that during COVID. But our track record would suggest that medical dogma, when it gets a life of its own with bandwagon thinking, unchallenged by other doctors or the media that's supposed to be doing a job, can do tremendous damage. And that's why I wrote this book. I wanted people to see the blind spots in modern medicine, because it's not just that we may have created the modern day peanut allergy epidemic and the opioid epidemic based on dogma and resistant bacteria because of the overuse of antibiotics, and the obesity epidemic hastened from ignoring refined carbohydrates and demonizing fat. There's not just these errors, but if we got all of these things wrong, what are we getting wrong today? What are we telling people is scientific fact when the reality is we don't know? It's in someone's opinion. Maybe it's a reasonable opinion, but it's not based on science, and it's being presented as science. And when you do that, like with the belief that transgender surgery lowers suicide rates, where is that study? Show me that. It's never been done. It is not a scientific fact. It is a belief. And when you present it as fact, you scare the crap out of these parents who then agree to have this done because they're given misinformation If the study were done, we have to be open to that result.
Well, and actually, there are a lot of good studies. We've talked about this before that show the harm in transitioning children. And I think, as I think back about the AIDS thing and the HIV, there was a sense that we really don't want to talk about it. We don't want to say it's higher among, homosexuals because we don't want to shame anybody. But they just didn't want to deal with it. And my thing was, let's deal with it. Let's help them because, by withholding information and being so afraid to say something, we're actually harming that group of people. And we don't want to get into trouble when actually it can be costing people their lives. So your book is fabulous. My guest is Dr. Marty Makary. He's a New York Times bestselling author of the fabulous book, The Price We Pay. Personally, I love that, but this one is really good. Blind spots when medicine gets it wrong and what it means for our health. And if you're going to listen to anybody, you have to listen to Dr. Makary because this is a guy who really knows. The research is really done. Marty, you're the best. Thanks so much for coming on with me today.
Meg, always enjoy talking with you. Thanks so much for having me. Great to see you.
As we wrap up today's episode, remember that you can stay connected with us by visiting us at microparenting.com. And for all of you parents, I want you to know I'm so excited about a brand new program that I started on coaching dads. So if you're a dad who needs a coach or you're a mother who wants your husband to be coached, check it out, microparenting.com. And always remember that great kids are raised, not born.